is conus arteriosus, and that's actually a heart chamber. It has cardiac muscle. And it splits and forks into a Y. Each of these are truncus arteriosus, and then from there the blood vessels are the same on the frog's right and left side. Now, it looks like this left side's a bit easier to see, so we're going to look at it for this frog on the left side. This one's pretty well dissected out here. It's in good shape. There are then 3 arches that come off the truncus arteriosus. The most anterior is the carotid arch. The middle one is the systemic arch. And the bottom one is the pulmocutaneous arch. We'll start with the pulmocutaneous arch. It has 2 arteries that lead off of it. One to the lungs, which is the pulmonary artery, and one to the skin, which is the cutaneous artery. Most of them don't have an intact cutaneous artery, but another way that we could pin cutaneous artery is from one of the actual frog skins. So when we're peeling off the skin, there's lots of blood vessels, the skin's very vascularized, so we could have cutaneous artery from the skin, that'd be a pink one, or pulmocutaneous vein from the skin, that'd be a blue one. We'll go back up to our arches, and this arch again was a carotid arch. It has 2 blood vessels you have to know. The external carotid artery is this one, going up underneath the mylohyoid muscle, so it's a little more superficial. Sometimes we can see the thyroid gland next to it, and I think that's it right here. It's a little bit mashed on this one, but it's a brownish or pinkish lump. The other direction here is the internal carotid artery, and that one's easily distinguishable because of this bulb-like structure, which is called the carotid body or carotid gland. I can't remember what term we used for you guys.
Gland.
Yeah. It's the same thing. Okay, and then that finally leaves now the main systemic arch right here. We'll continue with the systemic arch. And let me manipulate this just for a moment. Okay, if we move this around, we see these 2 branches here are the systemic arches, left and right systemic arches. And we're going to take a look at some vessels leading off the systemic arch. There's one way down here that you can see I'm lifting up, and it continues on up this way, this red one. It is a subclavian artery. It's subclavian as long as it's in the thorax. Once it gets out in the forelimb, so about right here, the name changes to brachial artery. So just like some roads change name when you get past a certain city or another side street, that's what happens with this one. It goes from subclavian in the thorax to brachial once it actually gets into the arm region, the forelimb region. The last one is occipital-vertebral. This is one of the few frogs I've seen where you could see this. If you look down in there, what you see is 2 parallel blood vessels. The bottom one here I'm lifting up here is the subclavian. The anterior one toward the head, I'm lifting up, well, I can kind of get my probe underneath it, trying not to break it. Right in here is the occipital-vertebral. It's large in diameter, but it's short, and it goes straight down into the muscles of the back area, hence vertebral. Okay, any questions so far? Okay, continuing with the 2 systemic arches here, they join together to form the dorsal aorta. And let's see if we can find dorsal aorta. And that is one here that runs kind of along the backbone, just underneath the vertebra. That's the dorsal aorta. And there are a couple tributaries off of this one, or a couple branches off this one that you need to know. And that includes this first one here, which is almost as big as the dorsal aorta itself. This is the celiaco-mesenteric artery. That divides into, let's see here, you guys may have to remind me on that one. A celiac artery and anterior mesenteric. Does that sound right?
Yeah.
Okay. And then you have to know no branches of the celiac, but from the anterior mesenteric, you have to know the branches that go to the intestine. Those would be intestinals, all of this red here in this big fan, or the main line is the intestinal. There is a side one. Everything's gotten flipped around so much here that's a bit hard to see, so sorry from all my manipulations. But this little tiny one right here, which leads to the spleen, is the splenic. Okay, continuing on. Flip the gonad back here just a minute. And flipping even the kidney back. The kidney is the big blue structure. What we see is a number of parallel vessels going to the kidney, and those are urogenital arteries. Well, some of them go to the kidney, some to the gonads. At the same level, but going to the back musculature, are lumbar arteries. Now, some of these have been torn, but you can see some of these right here. They're right at the same level, but the key thing is where they go to. So urogenital to the kidneys, lumbar arteries go to the back muscles. Finally, the dorsal aorta ends in a Y right here, with each major branch being a common iliac artery. The main line of it continues down deep into the thigh where it becomes the sciatic artery. And we can see the sciatic artery perhaps easiest right here next to the sciatic vein. The white is the sciatic vein, the red is the sciatic artery. Now, there are two branches, small branches, coming off the common iliac, which I'm going to flip back over. This may not be that easy to see in here, but you can see two branches, one right, sorry, let me help you out here. One right here, and then one down below it right in here. The top one is the epigastric artery going to some abdominal wall muscles. This is epigastric. The bottom one is femoral artery right here. You can often see this one reddish right in this area here, but it's gotten a bit torn. But that is the femoral artery. But the main line is sciatic. Then once that branches off, you can see the beginning of the sciatic right now. Whoever did this did a really good job of dissecting. And that's a bit of the sciatic, but you saw it better down there. And that's all the arteries. Okay, veins that are on your list. You got anterior vena cava, which there are two of them, left and right. And they often don't inject real well, but we can see some of that on here. There's a lump right in here.